Good afternoon of the 18th Kalpavriksha, a national CME program for postgraduates.
A flagship national level CME program for the postgraduates in ophthalmology. So this year we are truly honored to host over 300 bright and passionate young ophthalmologists from 35 different institutes across the country. Your presence here today reflects your academic dedication. We are equally privileged to have with us distinguished panel of renowned faculty members, esteemed experts in their respective subspecialties, representing premier institutes to share their vast knowledge and experience is what makes Kalpavriksha a truly enriching experience year after year. Our chief guest, the respected Dr. Ezhilan, member of Legislative Assembly, a strong advocate for healthcare and medical education. Sir, your presence today is both inspiring and encouraging, and we are deeply grateful for your time and support. We hope to ignite deeper discussions, inspire new perspectives. On behalf of the organizing committee, I extend a warm welcome to all the esteemed faculty.
Ocular oncology at Dr. Agarwals Eye Hospital to share a few
chief guests, dear colleagues, media personals and dear students. Here we have all gathered to open the 18th Kalpavriksha. It was in 2007, Professor Dr. Agarwal introduced this session. The main objective of Kalpavriksha is to share the knowledge, academics, clinical and surgical to all the students irrespective of the institution. So,
award at ACRS 2020.
Hi folks. First of all, thank you very much for Dr. Ezhilan, Naganathan for being here. Thank you, sir. We feel actually very proud because it's very rare to find a practicing doctor, also an MLA, also helping the community as well as the field a lot with us on stage. So a big round of applause to you for making the time and being here with us. Along with that, obviously, just a little bit quick brief on as to why we hold Kalpavriksha. Kalpavriksha to us is very, very dear because at some point we were also right there and we were also learning, and it's extremely important as to what you learn and how you build your learning blocks. If you learn from the wrong person in the wrong way, you obviously end up unlearning a lot when you are actually practicing. So it's very important for us, and it really is near and dear to our heart personally as well as professionally because we're in the field. Important point about Agarwal, obviously we have about 300 students here, but a lot of predecessors of yours who've been here have actually joined the fellowship program, joined hands with developing society and community in ophthalmology overall across this country, not just the state. So this is a very important aspect that I want people to kind of take back home with them. The other aspect of, it's really is one place where you get a real strong crash course about what all you need to do for your exams. And I know how you've been continuing this program, and we wish to continue as much value out of it for you guys because it's extremely important what you go from here. Where
Dr. Shika Benz.
Sir.
Thank you, sir. And now I would request you to hand over the next award also. This award is to G. Dr. S. Sara.
Sir. Look at the camera, sir. Sir. Look at the camera, sir. Sir.
Naganathan to share a few words with us.
Good afternoon, friends. I'm very short because I'm just waiting. I really congratulate Agarwal Eye Hospital to do a wonderful CME program for postgraduates. That was 18th edition. We're just discussing with Ashvin and Agarwal about the topics being covered, the efforts being made. See, in case of any medical institute or any medical education, first it's patient care. Yes, that is vital. So, predominantly 90% and 99% of many of the private setups, private service providers are limited only to patient care. Now, Agarwal has made one more surmountable strides in research, teaching in the form of continuing education program, which is very vital for any institute to expand. That is across mutual transfer of knowledge, mutual transfer of best practices in the respective specialties is the core for any institute or to deliver this type of services, which is very vital. Running an institute serves that particular segment of population, yes, accepted. But doing an education program, they are expanding the branches. So when you learn your best practices here, and we're going to start up their own respective units elsewhere or in future, so you'll be taking up the very vital discussions in various topics which has been discussed today. I come here on two bases. One as a people's representative and second as a treating physician. I'll do the latter first. So I have an active practice still going on. What does physicians, ophthalmologists think? Because we are into the world of metabolic diseases, especially in southern part of India. We all carry a diabetic gene with us. We have started seeing hypertension and diabetes at 11th and 12th street. A recent survey, school survey which I did in my constituency in urban slums, irrespective of the social strata, systemic hypertension was around 11%. Diabetes is around 13 to 14%. Alarming. Imagine at 12th standard, a kid, a boy or girl developing hypertension, diabetes. In a matter of 10 to 15 years, their end organs are going to be affected. So at the age of 30, 35, they land up with stroke, heart disease and dialysis. Now all our intensive cares, when we started our practice was geriatric. Now it's young population in our intensive care. Young women are in intensive care. No wonder we have metabolic liver diseases going up with a very huge incidences. Why should I address these to an ophthalmologist? Because you are the eye opener, right? Your detection of diabetic retinopathy, your detection of hypertensive retinopathy warns us, as well as it also gets oriented for a physician to get exposed. My humble request to Ashvin is to conduct a CME program for practicing physicians to how to look over the fundus, how to detect hypertensive retinopathy at early stage, how to detect diabetic retinopathy at early stage. That type of CME program for actively practicing physicians is very vital because it gives us a direct vasculature assessment. For a coronary angiogram, I have to do an invasive procedure, right? For an ultrasound, I have to do a Doppler, renal Doppler to detect. For a carotid, I have to do a carotid Doppler or an MR angio. But here, I have got a simple clinical examination tool to directly visualize the blood vessels in part. So your role is very significant for us. Your knowledge on this metabolic diseases and its pattern is very vital for us because you are the ones who visualize the vasculature indirect and warn a physician or warn the patient about the control of metabolic parameters on that one segment. Second, see, an eye opener means it's an external manifestation of systemic diseases. So I will humbly request our ophthalmologists to get oriented on these systemic patterns or ophthalmic presentation of systemic diseases. Because a choroid TV, a PO for evaluation, right? My experience is this, a choroid so far. So we have conducted around 10 camps so far. All complicated cataract surgeries have been done by our Kalekar Carpet scheme by Agarwal Eye Hospital. So the legacy of community ophthalmology continues. And we update our knowledge in various scientific endeavors and getting exposures coming up worldwide far. Thanks a lot.
Thank you, sir. Wow. From the incidents of BP in teenage to talking about legacy of Agarwals, that's such an interesting talk.
Ready, sir? Sir? Hello.